Welcome to this week's episode of Making the Shift from RN to NP. I'm Katie Vogelart, nurse practitioner. In this limited podcast series, we'll explore what it's really like to make the transition from RN to NP. At Hippo Education, we work on real-world, practice-changing guidance to help you become the best NP you can be. For being a listener, we'd love to share with you our free NP clinical resource guide, which you can download at hippoed.com/makingtheshift. Now let's get started. I am so excited to talk today to my guest, family nurse practitioner Morgan Hasting. Morgan has been out of school for only a year, so the transition from RN to NP is still very fresh for her. Morgan has not only gone through the journey of changing her careers over the last year, but she's also learned more about how to care for herself so that she can be the best NP she can be for her patients. Morgan, I'm so happy to have you here today. Welcome to the podcast.
Hi, thank you, Kate. Thank you for having me.
So Morgan, you've been out of school for just about a year now. Tell me how the last year's been and how was that transition for you from going to RN to NP?
Yeah, it's been kind of a wild ride this past year. There's been a lot of challenges, but at the same time, I've just learned so much and I've had so many successful encounters with patients. I've grown as not only a provider, but I think I've had a lot of self growth as well. I had a little bit of an interesting transition. I basically did all of my clinical hours on one clinic and was able to transition to that clinic for my first job. So that's been a really, there's been some ease with that transition, but there's also challenges that you also have with staying in the same clinic as the first job.
I can imagine that there would be some challenges and staying in a place that you've been a student for 1,000 hours in your program, over 1,000 hours in your program. What were some of the unique challenges to starting in your first job as a clinician when you've been there as a student?
Yeah, so I really grew to love all the patients that I took care of for the 2+ years I did clinicals at that clinic. But it also came with the challenge of they had to disassociate me with my provider that I worked with all the time. They were having to now see me as a more independent role. And for that, that's some of them it's still hard and it's a little bit of a challenge. They want to see, the provider and me or just the provider. They don't want to just see me as the nurse practitioner. So that's been a little bit of a hurdle that I've had to overcome as the first couple of months and still ongoing. But at the same time, I've gotten a lot of support from patients that are excited for me. They've been cheering me on throughout my journey. So that's been really encouraging. I've been taking care of the same patients now for 3+ years, and it's been really awesome to see that journey that we've been on and that growth and that we've experienced together for them.
Morgan, I think your year of just experiencing some highs and some lows, or maybe not lows, but just struggles, is very normal for NPs that are transitioning from RN to NP in that first job. If you could transport yourself back in time and talk to Morgan in her last semester or two before you graduated, what advice would you give to yourself for that first year in your job?
Yeah, I would tell myself, give yourself grace. I think I put a lot of pressure on myself starting out in this new independent role that I had to be the perfect provider. And the real, thing that I need to focus on was how can I best support my patients? Um, I've learned that, I'm not going to know everything. Um, I love the analogy that someone told me once. Nurse practitioner school, it's like somebody takes a fire hose and they spray you with all this knowledge, and you're a sponge and you have to soak up as much as you can. Ideally, you want to soak up all the knowledge, but sometimes that's not possible. And so, I'm very candid with my patients, and I do tell them, if I don't know something, I don't want them to lose confidence in me, but I always tell them if I don't know something, I'm never going to tell you the wrong answer. I'm going to find out for you. So I think that I would not place so much pressure on myself going out, because that's something that I had to kind of learn the hard way the first couple of months that I was in practice. And once I was able to just kind of take a step back and put less pressure on myself and just focus prioritizing patient care and how to do that. It was better for my mental health, and it was actually the patients felt that in the room too. They felt that I was more at ease with them.
Yeah, that's huge. Is some of what you're saying that imposter syndrome that we don't talk enough about in NP school, but where you feel like, oh, do I actually know everything I need to know to take care of patients? Did you experience some sort of imposter syndrome in this last year?
Yeah, I think I definitely battled with that. I'm working for a provider who has 20 plus years of experience, and I would love to have all the knowledge that she has for our patients, but realistically, I don't. I have the love, desire, and passion to one day gain all that insight and knowledge, and I know what resources to grab onto and which ones to check out in order to give my patients the answers that they need. But for a while there, I was going home almost every day thinking to myself, did I do everything I did for this patient? And that's really hard to kind of disassociate too from your work life to your home life and not bring that home with you, because that's not healthy. Um, so I do think that I'm doing better with the imposter syndrome. I think too, I've gained a lot of knowledge this past year. I'm seeing the same patients too as well. So that's a little bit of a confidence booster when you build up that rapport with the patient, and you've created these treatment plans with the patient. You've created this game plan, and then you're able to see their progress. I think that's what helps build my confidence as a provider. But I think imposter syndrome is something that I'm probably going to continue to kind of live with a little bit for a while longer. But I definitely have gained a lot of confidence since the first, I want to say, like 6 months of my NP career.
That's great. I don't wanna put a damper on anything, but I still battle with imposter syndrome after being an NP for almost 8 years now. I still sometimes walk in and think, "Do I know what I'm doing?" Even though I do. It's just that lie that we tell ourselves. And I know that over the last year, you've done a lot of work. You mentioned doing some work and helping, to really take care of yourself, and I'm sure in those moments when you're feeling like you're not enough, you're inadequate, having some tools to help really care for yourself is important. Will you share with me what some of those tools are? How did you learn how to care for yourself, and how do you do that now as an NP?
Yeah, absolutely. So I did something crazy. I did grad school in the midst of COVID, and that was really didn't realize how difficult that was going to be on me mentally and physically. I worked as an ICU nurse for 5 years before I became a family nurse practitioner, and I started a job in the midst of my grad school program where I was basically an ICU float nurse. So wherever they had ICU patients, I would go and take care of them for the day. Didn't matter if it was an ICU floor or not some days. So that was very, very challenging. Um, my During this time, I really wasn't sleeping well. There was a lot of mental stress. My food, basically whatever was readily available for me, I really didn't have enough time just with my work and school life balance. Um, and I started noticing that I wasn't feeling great, physically and mentally. And one thing that kind of got exacerbated was my asthma. So, in the midst of my grad school program, I was introduced to functional medicine, and this was a new concept for me, something that I'm really passionate about now. But one of the things it teaches is food is medicine. So, one thing for me that I've really tried to work on is my nutrition. I found out what foods I'm sensitive to, found out what I'm allergic to, found I'm allergic to tomatoes this year. That was very heartbreaking for me. It's one of my favorite things. But that was good that I found that out because I've cut out a lot of my triggers, and that's one thing that's helped me feel better. It's reduced my exacerbations. Um, Stress for me, I've learned to meditation and deep breathing has really been effective for me. I also take Epsom salt baths. That's been really therapeutic for me, doing that a couple of times a week. Really want to get into yoga. That's the next thing that's going to be on my list. And another thing that I did last year that I noticed a difference since I haven't been doing is taking part in infrared saunas. So, infrared saunas is really good for detoxifying, it's great for circulation improvement, really helps with de stress as well. And that was just one thing. I used to exercise in infrared sauna, and that's one thing that I've kind of noticed I like to kind of get back to is there was a lot of great benefits that I was seeing when I was doing that I'm missing now. So it took me a while. I'm still working on my wellness path, my next big journey. I really want to try the elimination diet, because that's something that I have prescribed for my patients, but have not done for myself. And so I kind of want to be able to have, my success story, um, inspire them to do it as well. So, you know, wellness is a journey, but it's just something that I've really become passionate about. Probably most recently, last 6 months.
I think that you hit the nail on the head when you talked previously just about how stressful this first year of being a new provider, making that shift from RN to NP can be, and how focusing on self care or wellness, there's many words for it, can probably be pretty protective against some of the buffers, some of those stresses. If you are talking to a new grad NP who's about to jump into their first job, and you wanted to give them just like one small step to take, what's the one thing that you would recommend that they do just to help care for themselves as they're going into this stressful time? What would that be?
Yeah, somebody told me one time was you have to put your oxygen mask on yourself before you put it on others. And that's going to look a little differently for everybody. So whether, stress is their main priority or sleep or their nutrition, whatever is going to be, just pick one. Just pick one thing to work on. You don't have to fix it all at one time because realistically, our schedules are so hectic and our minds are going a million miles a minute that sometimes it's not realistic to improve everything at once. So, whatever they're struggling in with the most, prioritize that and then go from there.
Morgan, I think you've given us some really good next steps on what we can do to help just to care for ourselves in the middle of a really stressful transition in roles. When imposter syndrome, when those feelings are triggered, is there a specific situation that triggers that for you? And what do you do to sort of overcome those feelings?
Yeah, I think that when there are more complex cases, I guess not the textbook cases that we would love to see all the time that are easy to treat, that's kind of when the imposter syndrome kicks in, when the answers don't automatically come to me, when I'm having to do further diagnostic workup, refer to my resources. Um, but I always, if I don't know the answer, I'm always going to ask for help. And so I do have a community of fellow nurse practitioners and my collaborating physician who I will refer to for those instances. Um, with imposter syndrome, I think too, I grew up with a really awesome role model. My grandfather lived in a really small town, owned his own practice. He was a family physician, and it was just really inspirational to see the impact that he made for his community. He worked for 4 decades for his community, and he not only took care of individuals, but he took care of generations within a family. So it was really awesome to see the relationships that he developed with the people in his community and how amazing he was as a provider. He was not only, brilliant, but he was very empathetic and he had incredible bedside manner. And that's something that's super rare to find, I think, nowadays. People aren't able to take the time to sit and just listen with patients. So that's something too that I try to pride myself on with my patients is I think in some instances, what would my grandpa do? And doesn't matter how busy I am for the day, I always have time to listen and be present for my patients because it's the small acts of kindness that we do in our profession that really makes the biggest impact for our patients.
Man, that is so true, Morgan, that you can be the smartest, you can have absorbed all of that fire hydrant or fire hose of knowledge from NP school. But if you don't sit down and look your patients in the eye and listen to them, then are you really caring for them? So I think
Yeah.
that's really great and something that we can all take away from is just to sit down and listen and look our patients in the eye and being a human, a caring human, there's no imposter for that, right? We all know
Right.
how to do that. We're nurses, we know how to do that. Morgan, I am so thankful that you shared your journey with us, and all the best in your future many, many, many years and decades as a nurse practitioner. Congrats on finishing your first year.
Thank you so much.
Thanks for listening to this episode of Making the Shift from RN to NP. Be sure to head to hippoed.com/makingtheshift to get your free NP clinical resource guide. Visit hippoed.com/NP to explore even more education from Hippo to make your transition from RN to NP as smooth as possible.